Hi, welcome to Acharya's Learning. I'm Subash, and this is Endocrinology. So guys, today we'll be discussing about the calcium and phosphate regulations and also magnesium regulations, okay? So that will be our topic for this lectures, okay? So whenever we talk about the calcium and your phosphate or your magnesium regulations, you should remember that, we need to know, is there any glands or hormone that is actually playing a role in regulating your calcium, okay? And that's what we've discussed about first, okay? So whenever we talk about the calcium and phosphate regulations, there are a couple of organs that plays a very, very important role in maintaining or regulating your calcium and phosphate balance, okay? And that is number one. If we come back here, okay, what is this? So this is going to be like, look, if you come back here, okay, this is going to be my thyroid gland, okay, this is the green thing. And on top of the, you see this right here, 1, 2, and this 3, and then 4, right? This is so-called your parathyroid gland. And you have to know there's the locations of this parathyroid gland. And it's very, very important because these parathyroid glands are located on the posterior surface of your thyroid gland. And there are 4 of them in this diagram. But you should remember, there are, sometimes some people may have 5 parathyroid gland, and even some studies shows there some people have even 6 parathyroid gland, okay? And this parathyroid gland is very, very important because remember, whenever you remove this thyroid gland, it's really important that you do not remove this parathyroid gland, okay? Because if you remove the parathyroid gland, there are going to be certain consequences, okay? And we'll talk about what those are, all right? And right now we just drew this 4 of them, okay? And this parathyroid gland, okay, if we talk a little bit of histology of this parathyroid gland, let's just quickly talk about this, okay? This parathyroid glands, as we said, they're posterior surface, okay? They contain the 2 types of cells, okay? They contain, let me write it down here. One of the cells they contain, okay, there is a main cells, which are called chief cells, okay? But remember, these cells, okay, these cells are more like when in appearance, okay, they're more arranged like in a cord-like structures, okay, cord-like structures, and then which is kind of like capsulated around your connective tissues, okay. And not only that, they also have, there's other different types of cells, okay. So if let's say this is my your chief cells. On below that, there's also another type of cells, okay, and those type of cells are called oxyphil cells, okay. Oxyphil. They also called acidophil cells. Okay, the reason why they call oxyphil cells is because they contain larger cytoplasms comparing to your chief cells. Okay, chief cells are relatively smaller comparing to those oxyphil cells. Okay, and the reason why it's important you should know about these oxyphil cells is that they do not have any secretory functions. Okay, one thing does happen is that as you age, these oxyphil cells, they do get like smaller in sizes, but so remember that whenever you trying to figure out whether to distinguish between oxyphil or chief cells, okay, this chief cells, this oxyphil cells, whenever you put eosin, okay, the dye, they become, their cytoplasm become very, very like red, okay. That's the reason why we also call this as acidophil cells, okay. But remember, this is one of the distinguished features of like chief cells, okay. And then also below there, okay, there is another chief cells would be there, and and you guys should remember that the chief cells is very, very important because the chief cells is the one that is actually contain what they contain. They contain lipofuscin granules, okay, or they have those chromosomes to synthesize your parathyroid hormone, okay. We have to talk about this parathyroid hormone. And this parathyroid hormone is the master regulators of your your calciums and your magnesiums, okay? So, and also your phosphate. So you have to remember that, okay? So and we'll talk about it in more detail because this parathyroid hormones is the one that is actually going to, help retaining calciums, okay? And also magnesium. So, all right? And in order to help, maintaining the calcium, it's gonna work into different types of organs, okay? The parathyroid hormones are receptors located in different parts of the organs, okay? And we have to talk about those organs here, okay? The main organs that parathyroid hormone works into is one of them is going to be this is going to be your bone, okay? In bones, okay? This is where the calcium, okay, and phosphate get mobilized here, okay? And that's going to bring it into plasma, okay? That's what's going to happen. Other part is that we also have to talk about the GI systems, okay? And this is why what happens here is that the parathyroid hormones first works in your kidney, okay? And it activates your another hormone, which is called vitamin D, okay? And this active vitamin D works in your GI system to reabsorb your calcium and phosphate, okay? That is how parathyroid hormone indirectly works into your GI systems, okay? So by activating a vitamin D, which is on your kidney, and we'll talk about in detail, and then after that, what's going to do is that the vitamin D will reabsorb your calcium and phosphate in on your GI systems, okay? That's what we'll talk about this. All right, now, so if you come back here, okay, guys, like, look, this is this is my your extracellular fluid, right? And then this cells right here, this is going to be my chief cells, okay? And this is my bone here, and from the bones I took the two cells here, osteoblasts and the osteoclasts, and we'll talk about that in detail. And then what is this? This is going to be my nephrons, right? Now, we'll talk about this. What is this going to happen? Now, so what's going to happen is that, whenever there is a falling level of calcium is going on, okay? Before even that, that's just normally what happens, okay? Whenever the calcium is there, okay? What happens is that this calcium is, okay? The calcium is going to come, okay? And there's certain receptors located on the chief cells, okay? And these chief cells is here. And this chief cells has the 7-pass receptors, okay? Or let's just say this is a 1. So basically, we'll just say this is a 7-pass membrane receptor, okay? And then whenever there's a calcium comes, okay? Calcium comes and binds into it, okay? And this is called, look, let's say we can simply say calcium sensitive receptor, okay? We can say this. It's called, what is it called? It's a calcium sensitive receptors, and it is a 7-pass receptor. And we can simply say this is a G protein receptor, okay? We'll say this is your G protein receptor, okay? It's a couple of G protein, but this one is actually bound with your GQ, okay? So and you guys know from now, okay, what is going to happen with the GQ, okay? The activations of what is going to happen is that your phospholipase C is going to happen, right? Your phospholipase C is going to happen. And what is going to phospholipase is going to do? You guys know this. Phospholipase is important here. What is hanging down here? Your PIP3, right? And it's going to work into it and break down into your IP3 and your DAG, right? And this DAG will further activate your protein kinase C. That's what's going to happen, right? And then let's just quickly make this. And here, guys, what's going to happen here is that I'm not going to go to the engineering of the parathyroid hormones, because remember, these guys, they will stimulate certain genes here, okay? And then that's going to make what? Pro parathyroid hormones. And then, okay, and then that's going to get cleaved and it'll become pro parathyroid hormones, and then ultimately it'll become a parathyroid hormones, okay? That's what it's going to become. But in the cells, they're actually kind of, there's a granules, okay? These granules are called lipofuscin granules, okay? And this is the one that called parathyroid hormones, okay? So this is what happens. So whenever, let's say, whenever this IP3 comes in, right? And then IP3 comes in right here, look, what is going to happen? Or your protein kinase, look. Really what happens is that, look, this IP3, what it does, it actually inhibits this. You have to remember this, okay? So basically what is going to happen is that, so basically whenever this pathway gets activated, right? So when the parathyroid hormone inhabits this parathyroid hormones, what's going to happen is no longer this parathyroid hormones will stay in these granules, okay? So because of that, what is going to happen is that this will come, okay, and then fuse here, okay, and then they'll secrete out into your circulations, okay? So parathyroid hormones are continuously producing in this way, okay? Continuously, so parathyroid hormones are productions constantly it's producing or releasing into your circulations, and they're doing their function. They're going to go and work onto the receptors, okay? That is normally happens, okay? But whenever there is, let's say, like a falling level of calcium is going on, okay? whenever falling level of, let's say, calcium is going on. Not only falling level of calcium, whenever there's a falling level of magnesium, we have to talk about that too, okay? Or whenever there's a falling level of, let's say, increased level of phosphate. Okay, so what's going to happen is that, let's say like this person has hypocalcemia, or the calcium level is going down, okay? So whenever the calcium level is going down, what is going to happen is that, okay, this calcium would, what is going to happen? This calcium will no longer can, what is going to happen? You know, bound with these receptors, okay, and do its functions. So because of what is going to happen, this calcium will go relaxations, okay. So this will, it will cause a relaxations of this receptor. Because it's going to cause a relaxation of this receptor, what is that going to happen is that, okay, what is that going to happen is that, okay, relaxation is going to happen, right? So if the relaxation happens, what is going to happen? This calcium. The calcium will relax. That means this IP3 will, what's going to happen? IP3 will no longer able to, what's going to do, okay? It will cause relaxations. That means what's going to happen? This IP3 will no longer, there will be no enough increased level of, look, IP3 and DAG will be produced, okay? So whenever there's no increased level of IP3 and DAG will be produced, they will no longer able to inhibit, okay, this, the parathyroid hormones secretions, okay? That means what is going to happen is there will be greater amount of parathyroid hormone will be actually secreting from here. Okay, that's what is going to happen. So more parathyroid hormones, all this will be secreting into your circulation. That's what is going to happen, because by putting phosphorylations, okay, what is going to happen? By putting phosphorylation into this, okay, by putting phosphorylation, it's sort of like inactivated. Okay, that's what it happened here. But whenever there's a low level of calcium in here, what is going to happen is that they're no longer able to, okay, they will no longer able to, you know, inhibit the secretions of the parathyroid hormones. So what is going to ultimately result will be is that low level of your low level of calcium and magnesium result into increased level of parathyroid hormone secretion. That's what is going to happen. Okay, so that's what's going to happen. Or same applies for the low level of magnesium, okay, or increased level of your phosphate. And remember, guys, calcium is very, very important, right? Like for our system. And I'm talking, whenever we talk about calciums, okay, we're talking calcium. That is what this calcium we're talking about. This we're talking about like a free calciums or ionized calciums. Let's just quickly talk about that too. Okay, this calcium, because remember, guys, in your body, calciums are in a three form. One is bound with the plasma protein. Okay, that is what it is. And this plasma protein is bound with the plasma protein. It is inactive, right? And other one, calcium, is bound with calcium complex with anions. And other one is a calcium which is a free form, or which is a ionized calcium. And this ionized calcium is the one, the biologically active calcium, because this ionized calcium is the one that has a function in the cells, okay? And if you remember, the normal level of calcium is about like 8.5 to, let's say, 10 milligrams per deciliters, okay? That's a normal level of calcium. But remember, this calcium I'm giving you, that is the total number of your calcium in the plasma, okay? That does not mean, this does not tell you that it's a free calcium, though, okay? Because remember, as I said, calcium in extracellular fluid right here, it's in a three form, okay? They're in a bound with plasma proteins like albumin. Okay, the calcium with, bound with anions like phosphate. One is phosphate, right? Let's just write down phosphate. Okay, other ones are calcium like citrate, okay, or even sulfate. Okay, that's what it is. But we're only talking about this ionized calcium, free calcium. This one is going to have a biological functions, okay? And remember, in your plasma, about like 4.56 milligram per deciliter. That's bound with plasma proteins, okay? And we can simply say about 4.72 milligrams per deciliters, that would be free ionized calcium. And when we talk about this is the calcium, the ionized calcium has a functions, okay? This is what it is. And remember, the calciums are what? The calcium has major functions in our body, right? Let's talk the calcium's functions, okay? Remember, it is calciums are for, what are the for? Okay, look. One is for the calcium is for what? Contractibility, like even for the cell to function, right? Contractibility, cell to function normally, right? What else? Calcium are required for those neural like transmissions, right? That's what it is. So calcium is, remember, what is the IP3 is going to do here? It's going to go to the sarcoplasma, endoplasmic reticulum, and do this calcium, right? So that's one of the functions of that one. So what is that? The intracellular signaling. That is the other functions of calcium, right? What else? You don't want to forget, the calcium is required for what? Coagulation, right? That is also required for coagulations. Okay? What are calciums required? For the membrane stability, okay? Okay, and these are some of the functions of the calciums. Okay, it's really, really important. Okay, that you know about the calciums and where do you find the calciums? Most of the calcium located in. You guys know this, right? The calcium, most of the calcium located in where? In bones, right? Bones and your teeth. About like a 99% of your calcium is located in your teeth and your bones. Okay, and about 86 or 85% of phosphorus is located in your bones, right? So you should remember that the majority of calciums are found in your bones, right? That's the reason why, you know, whenever we need more calciums, okay, we need the hypocalcemia, we go to bones, you know. That's what we call the bones are also known as, it's a bank depositions, okay? It's like a bank, okay? So whenever you need, you know, money, you go to bank, right? If you have some saving, right? So you can think about your bone as like a saving account for your calcium, okay? So that's what it is. Now, and usually only about like a 1% of calciums would be in ionized form or free form, okay, like 0.1%, okay, and then 1% would be, as you know, that would be located on the interstitial floor, right? Like for example here, this is interstitial floor right here, okay. That's also, you have to think about that one too. But these are some of the functions of calcium is very, very important, right, for our body, and parathyroid hormones are very, very important for, you know, regulating this calcium and magnesium. But not only this, calcium, we're talking about parathyroid hormones, but remember, as I said, parathyroid hormones, vitamin D, and also one more, that is calcitonin. Okay, what is calcitonin? Remember, this thyroid gland, what do they have? They have, remember guys, we talked about these parafollicular cells, okay, or we call them a C cells too. They release calcitonin, okay, and those calcitonin does what? They actually do, you know, whenever there's a high level of calcium in our body, they remove this calcium, okay, to maintain the homeostasis, okay, to maintain the internal constant environment. So whenever we discuss about the balance of your calcium, phosphorus, magnesium, we always have to talk about those three hormones. One is parathyroid hormones, okay, one is calcitonin, okay, and other one is your vitamin D, okay. So these are the three different hormones that we always have to talk about whenever we discuss about the regulations of your calciums and phosphate, okay. Now, after this, okay, let's come back here. Now, so there's inverse relationship between, coming back to the cheap cells, inverse relationship between the declined calcium and magnesium level with the parathyroid hormones, okay. As the calcium level and magnesium level goes down, what is going to happen? Parathyroid hormone secretion goes up, okay, and you need to remember that, okay, because it relaxes the receptor. But there's one more thing that I'm going to tell you, you know, this is extra, you know, and you always get extra here. You know, sometimes, like, you know guys, like whenever you give lithium salts, okay, to bipolar patient, okay, who has the symptoms of mania, okay, whenever you give them a lithium salts, have you ever, you know, you might have those patients that they may show up and showing in the blood report to having a hypercalcemia, okay. The reason why that happens is that if you give the bipolar patient the lithium salts, the medications, what is going to happen is the lithium salts, that's right, the lithium salts, are right here. Okay, those lithium salts, what it does is that it also relaxes the receptors, okay? So it relaxes the receptors. So because of that, it will no longer able to have an effect on the parathyroid hormones, okay? So in that case, what is going to happen is that you'll have an increased level of parathyroid hormones, okay? That's the reason why people who are on the lithium salts, they have hypercalcemia also, okay?